this video, we're going to go over an isometric hold of a hip airplane motion. So this is starting to try to kind of progress the balance portion of the hip airplane without relying on something to hold on to. But the hip airplane is very dynamic in nature, and it's really hard to stay balanced as you're flowing through this rotational pattern of the hip. Again, that is an ideal end point of this exercise and the ideal goal, but it takes a while to get there. So basically, instead of trying to jump right into that, we're going to now do your normal warm up of the hip airplane with support, but then we're going to be isometrically holding each in position. So for this camera shot, my face is going to most likely get cut off, but the point anyway is to see what's happening from the waist down. So basically, positioning wise, again, use support to get into the end range. So left foot's down, right hand's helping me support. I tip forward, core is braced. I keep my chest up, and then I switch hands to open up my pelvis. So from here, once you feel like you have good balance on this foot, so make sure to push through the big toe, spread those toes so you have a nice foundation of your foot. And then from there, depending on what you want to do with your hands, traditionally in yoga, it's usually kind of like one arm is up here, one's down, and there's like a yoga block there to help with balance. But what you can do, so with the hand closest to a supported surface, is again, you can stay in this in range, really try to gain your balance, and then just maybe have your hand hover away from the supported surface, just in case you need to touch it to regain your balance. And I'll have you kind of do that for a prescribed amount of time. So that is one in position of the hip airplane, right? Is the opening up of the pelvis. And this is controlling external rotation of the standing hip. That's why it burns so much. You have those glutes burning, the deep external rotators burning. And then you go right, you come back to the start position, which is back foot, toes are facing down to the ground. Same thing, make sure your foot's in good foundation, let's spread reach the toes, tack those down lightly, and then let go of the surface. What is this, Warrior 3? And then from there, if you need to take a break, totally fine. I feel quite a bit of a burn in my leg. And then the last in position, so you tip forward here, is going to be hip internal rotation. So deep internal rotators are firing to control this motion. Hold it here and let go of your surface. Wow, I feel quite a bit of a burn on the inner hip, deep in the hip capsule itself. And then again, you're here for support, get out of the position. So be patient with yourself for this. I'll prescribe hold durations for all three of those different in positions. I think it feels as though the internal rotation hold is going to be the most uncomfortable of those muscles that are firing to help stabilize you. So please be patient. Take breaks when you need to. Play with volume over time. With how long you hold them for and for how many sets based on how sore you become. So I don't want you to be so sore that you feel it for an entire week. Maybe for the first time that you do this, you'll be sore for maybe 2 or 3 days later, but that should get better over time. So that is variations of hip rotation in positions, working on building up your balance in those in-range spots. And then hopefully, eventually, we can kind of segue into dynamic hip airplane motions without relying on the surface for balance.